panelists, and all other delegates. We heard about the keynote address about the human health and its holistic approach. Now, let us have a view of experts on a need of a holistic human health. It is my privilege to introduce today's moderator and UHG point of view, Dr. Sarmila Asthana. Dr. Sarmila Asthana did her MBBS from Mahatma Gandhi Memorial Medical College, Indore, pediatrics from the Regional Children's Hospital, USA. Madam has worked as a assistant professor of pediatrics in St. Christopher Hospital for Children, USA. Madam served as a consultant pediatrician with the Apollo Hospital for about 17 years. Also worked with lipid diagnostic. Madam has keen interest in obligatory pediatrics, educating to the children for minimum use of medication. Since 2018, left practice and devoting full time to UHV, pursuing approach to health. Madam is resource person for UHV workshop as well as a holistic human health workshop. She is a co-authored book on holistic human health. Lives in Indore, in Hyderabad, with her family, and her interest is reading and writing books. With this brief introduction, once again I warmly welcome Dr. Sarmila Asthana. Over to you, madam.
Thank you. Thank you, Amipara ji. Thank you for that very warm introduction. Welcome everybody to this 10th International Conference Health Panel Discussion. We will be doing this panel discussion over 3 days. Today, we will be discussing about the state of health of the youth and about the health systems. Tomorrow, we will discuss the vision for holistic health. And on day 3, we will discuss the implementation of holistic health. So welcome everybody. Before we move on, let me introduce our esteemed panelists. So you can see
conference
Dr. Satyanarayanan ji, Associate Dean, Student Affairs and Professor of Pharmacology at SRM Medical College, Hospital and Research Center. He has some 31 years of teaching experience, 25 years of clinical and 15 years of research experience, with several awards and publications to his credit. He also has a keen interest in human values and holistic health education and is working for that. Welcome, Dr. Satyanarayananji. Then we have Dr. Sundarraj Perumal. Dr. Sundarraj is a distinguished Ayurveda physician, Panchakarma specialist, researcher, and educator with over 2 decades of clinical experience. He currently serves as director of Arogya Dhatri Ayurveda Research Institute, Vishakhapatnam, where he leads a 40-bedded Panchakarma hospital integrating Ayurveda and yoga to provide traditional treatments for complex and chronic diseases. Welcome, Dr. Sundarraj.
Namaste, madam.
Namaste, namaste. Nice to see you. And I must mention that the holistic health book that was mentioned by Amiparaji in the beginning, Dr. Sundarraj is a co-author of that book on holistic health. Welcome, Dr. Sundarraj.
Namaste.
We have sitting here next to Dr. Satyanarayanan, Ms. Kriti Sharma. She is the youngest member in our talk today. She is a second-year MBBS student at SRM Medical College and Research Center and is passionate about clinical medicine research and about bridging the gap between holistic healthcare and current medical practices, and eager to explore new ideas and opportunities in this field. Welcome, Kriti. Very nice to have you here. We also have with us Dr. Manoj Kumar Sharma, working as principal at Veena Memorial College of Education in Rajasthan. He has a doctorate degree on education from University of Rajasthan, Jaipur, and has published several research papers in national and international research journals and made significant contributions in educational teaching, research, and administration. So he is an administrator in education. So welcome, Dr. Manoj Kumar Sharma ji.
थैंक यू मैम, थैंक यू, नमस्कार, सभी का अभिवादन.
Nice to see you. Welcome to the panel. Dr. Sudapta, has he been able to join? Dr. Sudipta Ghoshal ji, a clinically practicing homeopath and also with nearly 25 years of experience in hospital administration, medical affairs, and healthcare services. He is head Department of Hospital Management in Paramedical College, Durgapur. Welcome, Dr. Sudipta Ghoshal. Nice to have you with us today. Okay. So,
Hello. Namaste.
namaste, namaste. Nice to see you.
Very good afternoon to all of you.
Good afternoon. Good afternoon. Welcome.
This is a very good opportunity to all of us to present here on the 10th International Conference on this topic.
Yes, nice. Thank you.
Feeling so delighted in this moment. Thank you. Thank you.
Thank you.
Namaste.
Namaste. So now, before going further, let me just mention the process that we are going to be using today. I will be putting forward a few words on the SWOT analysis of the state of health of the youth and of the health system today. And then I will be putting forward a few questions to our esteemed panelists about their views on whatever we discuss. And then for each panelist, there will be about 3 minutes in which they can give their replies. A stop clock or a stopwatch will appear on your screen on the right upper side of the screen. You can be mindful of that when you are talking, and please be mindful of keeping to that time of 3 minutes so that we can have the maximum rounds of questions possible. It is requested that we all keep our videos on throughout the process so that we are visible to all.
Namaskar.
So I think we can go ahead now. We'll move ahead to the discussion on, or to start with, talking about the theme of empowering youth to take charge of their health holistically, which is the theme for today. Yes. So this is a brief overview of what we will be doing in the next, starting from today. Today, we will be talking of the SWOT analysis of the state of health of the youth and of the health system. Tomorrow on day 2, we will be putting forward a proposal on a vision for health. And on day 3, we will be talking a little more on the implementation of this proposal for health so that we can empower the youth. So to begin with, let's talk a little bit about the SWOT analysis of the state of health of youth and of the health system today. Next slide, please. I hope the screen is visible to everyone.
Yes, yes,
Yes.
absolutely.
Okay. So if we begin with it, let us first say or discuss what exactly health is and if we are addressing it adequately. So if you look at the dictionary, health is described as a state of being free from illness or injury. But is that sufficient? If we go back to the WHO definition, which was given way back in 1948, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And if we go further to our traditional wisdom of Ayurveda within the country from our side, it is a state of complete physical, mental, and spiritual well-being. So this is the ancient system of the science of life. And in this, health is described as a system or a state of total balance, equilibrium, or harmony among the various systems of the body, along with an equilibrium of the mind and spirit. So considering these definitions from the WHO and closer to home from Ayurveda, we ask the question whether we are addressing health adequately today. So to consider this, we'll discuss the SWOT analysis, where S is the strengths, W stands for weaknesses in the current health system. We have many things that we can mention have been advancements in modern medicine. For example, communicable or infectious diseases have reduced drastically. COVID, of course, is an exception, but even that we can see from that debilitating state of leading to so many deaths, it has transformed to a milder version. So a lot of advancement has been made in this field of overcoming infectious or communicable diseases. If you look at antibiotics, they have really revolutionized medical care. What used to be deaths from typhoid, cholera, those kind of deaths, now they have been reduced tremendously thanks to antibiotics and even oral usage of antibiotics without too much of intervention. Vaccinations have led to eradication of global diseases like polio. If we look at trauma care, we have today advanced state-of-the-art techniques. We have surgeries, we have procedures that are saving many lives. So all of these are big achievements in the health system, which we can feel good about. But having said this, there are also several weaknesses. For instance, there is a lack of a holistic approach today. Today's health system, body seems to be the major focus. And as we specialize and super specialize further and further and further, even the body we seem to have broken down into bits and pieces. And we are specializing in ENT or eye or liver or kidney or heart and other diseases. If we look at physical health, we seem to be largely disease-centric or problem-oriented. So we often work more on bringing down systems, managing diseases for life, rather than curing the diseases from the root. And we'll look at a deeper vision of that in a moment. If we look at mental health, we are often treating mental health with medications which are being given to the body. Are we aware of the root cause of the problem in the mental health? Do we have solutions to actually fix the problem? If we look at the values and ethics today, a question we have to ask ourselves is, has profit maximization become the mantra of today's health system? With all of this, health as such has become unaffordable for the common man. It is overly expensive and out of the reach of many. And if this continues, we can see very clearly that in this current form, the health system is going to be totally unsustainable. So these are some of the weaknesses. Now we can see this, whether our focus is on the left side, you can see the disease-centric, where we are dealing with symptoms, or on the right side, where we are dealing with the root cause, which would be health-centric. So for instance, are we just covering a wound with a band-aid, or are we curing the wound? If you look at diabetes, the focus is on reducing blood sugar with the help of oral glycemics, insulin, etc. But what about curing diabetes from the root? Are we aware of the root cause and how to fix it? If you look at hypertension, today there is a multitude of antihypertensive medications to reduce blood pressure. But what about curing hypertension for good? We tend to use these blood pressure medications for life and end up using more and more and more medications to try to keep the blood pressure in check. If we look at pain, we are using analgesics. For fevers, we are using antipyretics and anti-inflammatory medicines. But again, if we were just to do this and not cure the root cause of fever, how good would it do the system? How good would it do to the body? If you look at peptic ulcers, hemorrhoids, and so many other things, it is the same story. We use antacids for peptic ulcers. We use laxatives for hemorrhoids. But what about the root cause? And when we talk of mental health, we are using all these medications for depression, anxiety, all of these and others, antipsychotics. But what is the root cause? So should our effort be on suppressing the indicator or on correcting the root disharmony? With all our research, why are we not able to find the underlying root cause of disharmony? Question we'll ask is our perspective right? Coming to the O or the opportunities in the SWOT analysis, So if we see, we may be missing something. And we ask the question whether we should be trying to address these various health issues separately, or is it time to question our very fundamental perspective about health? Should we be looking at health in a more holistic manner? Perhaps a holistic approach would be able to address many of these issues that are there in the current system. How can we look at health holistically? That we will discuss tomorrow in our vision for health. But to go on, there are many challenges and threats when it comes to the mental health of youth today. Mental health issues are at an all-time high. There is anger, unhappiness, stress, anxiety, you name it. Many problems are there. Mental health problems seem to be accounting for 45% of the burden and dysfunctionalities in the adolescent population. In many areas, these anxiety disorders in youth, studies show it ranges from 22.7 to 41% and even higher. Most commonly linked with societal social anxiety. Next slide, please. If we look at insomnia or smartphone addiction, which could be associated issues, a 2021 meta-analysis shows the prevalence in South Asian students to be 35 to 70% and a pooled prevalence of 52.1%. Looking at smartphone addiction, a study from 2022 shows that Asian medical students have a 41.93% of smartphone addiction. And of course, this will be correlated with many other issues like poor sleep quality, stress, anxiety, depression, and all of that. Next slide. The numbers just go on and on. For depression, the prevalence was almost 50%. And of course, we can see here again, anxiety, the numbers are as high as almost 60%. Stress is very high. Some of the statistics from 2023 say that 74% of Indians suffered from stress, while 88% suffered from some kind of anxiety disorder. So these are very high numbers. The CDC of the United States estimates that about 75% of all doctor visits are caused because of stress. And some other studies have shown up to 90% of visits to primary care physicians due to stress. A 2024 study of mental health issues among school children and adolescents in India showed that depression is the most prevalent mental health issue in our youth today. In 2023, prevalence in 5,944 undergraduate medical students in India was shown to be 50%. Depression was 50% in these students, medical students. All of this is leading to suicides and suicide ideations in youth. 2025, WHO says suicide is the third leading cause of death among 15 to 29-year-olds. And that 73% of global suicides occur in low and middle income countries. And if you look at Indian statistics, you can see that the numbers are very high, very alarming, in fact. Next slide, please. Again, these are more and more studies about students in Mangalore, students in Delhi with suicidal ideations. Some lead to actually going to the extent of committing suicides. But if we look at only the suicides, it's only the tip of the iceberg. Behind each suicide, there are so many others who may be there very soon. So is there something that we are missing here? What exactly is the root cause of stress? We say that stress leads to this, but what is the root cause? And once you have problems with mental health, physical health is not far behind. There has been an alarming rise in non-communicable diseases like obesity, diabetes, hypertension at younger and younger ages. So for obesity, we can see a 2025 study where you have data from National Institute of Nutrition in Indian adolescents 10 to 19 years that they are significantly overweight and obese. And these numbers are growing. As we go further, the numbers are increasing. Next slide, please. If you look at diabetes, once considered to be a problem with middle life, in 2025, studies are showing the prevalence of diabetes is increasing among the youth. In those less than 35 years of age, close to 20%. Those less than 30 years of age, 13%. And those less than 25 years of age also, 9.8%. So we can see that these numbers are rising very sharply. Younger and younger children and adolescents are falling prey to this non-communicable problem, which used to be in midlife, but now has come about in younger and younger ages. In 2024, there was a study which showed that over a 10-year period, younger individuals are showing a higher percentage increase in prevalence than the older group. So what is happening? Why is all this happening? Next slide. Hypertension and cardiovascular disease risk also is showing the same story. There is an alarming prevalence of high blood pressure in Indian youth. 35% of these youth and 25% of the 13 to 19-year-olds had blood pressure in the stage 1 or 2 of what is described as hypertension. So just imagine that our teenagers are now becoming hypertensive. Next slide. So we can see that there is a huge impact of mental health on physical health. While there are studies that say that these non-communicable diseases like diabetes, hypertension, cardiovascular disease are because of tobacco or food, poor diet, lack of physical activity. While that is true to some extent, but then what is the cause for this use of alcohol, poor diet, lack of physical activity? Ultimately, again, we come back to the stress being a common risk factor for many, many diseases, 75 to 90% of diseases. So definitely mental health does seem to have an impact on physical health. But what is the cause for the problem in the mental health? Next slide, please. So that question still needs to be answered. Coming to values and ethics. In today's health system, service orientation and compassion towards the needs of the sick appears to have deteriorated. It's become more of a fee-for-service transaction, an industry, a medical industry with the focus on profit maximization. With all of this, the sustainability of the healthcare system is also at stake here. Healthcare is becoming overly expensive, out of reach. There is fear that the escalating costs are not going to be able to be manageable for the common man. So all of these, are these all different and isolated problems, or do they perhaps have the same root at the end? Can a holistic perspective maybe help in this? So while this may seem like a very grim overview of the current state, But we can see that several facts have been put in place, and it talks of a need for a holistic and sustainable perspective on health. Now, coming to the views from all our esteemed panelists, I would like to ask a few questions. Let us start with Dr. Kala. If we look at the definition of health as complete physical, mental, and social well-being, do you think we are addressing health adequately today?
Afternoon. So thank you, madam, for the opportunity given to me, the first opportunity. Yeah, based on your question, definitely I could say no. It's not addressing fully.
Yeah. Nice. Let me ask Dr. Satyanarayananji, what do you feel about this? Are we addressing this health conditions adequately today?
So currently, as we see today's reality, the addressing diseases is not totally perfect. You can see that diseases like infections or trauma or that short-term problems we can cure them, but the problems like chronic lifestyle diseases like diabetes, hypertension, obesity, all these problems they are not addressed properly. In fact, we are giving managing the disease rather than treating them. So what happens is lifelong medication, so more and more complications, and more healthcare costs are increasing. So like that, they are becoming more and more complex. So we need a totally different perspective to change this type of managing diseases. And one more thing is, we can approach has to be changed. So traditionally, we see body-centered approach, which is, we treat the body rather than looking beyond the body. So what we miss is the mind, self, all these issues are not addressed in current healthcare system. And one more thing is mental health is not at all addressed properly. Particularly youth has many problems, so but they are not addressed adequately. And we see in the last the crisis point only we tried to address it. Actually mental diseases are starting very gradually over months and years, not suddenly. What happens is small level of stress lead to anxiety. Anxiety may lead to sleeplessness, insomnia. That will lead to depression, and finally land in suicidal ideation and as well as suicide. But last point only we try to address the problem. So what happens is we lose the unfortunately the kids. So like that we don't address at all. So to change the entire perspective, and we need a total paradigm shift.
Very nice, Satyanarayananji. I think one very important factor that you have raised is that these problems, we tend to address them when they are at the peak. And we have a student here with us, Priti Sharma. Maybe you can talk to us about what do you think about the current state? Is it that things peak suddenly, or are there lots of pressures and tensions which are leading to this over time?
Today there is a rise of lifestyle diseases, like Sir said, chronic lifestyle diseases, and these diseases do not develop on their own suddenly. There is a lot of wrong lifestyle behind it, chronic stress that leads to it. Especially in the youth, I can speak for myself. In medical students, especially, there is a lot of stress because of our course, because of the daily things we are exposed to, and we read so many reports that nowadays in doctors there is a very high prevalence of hypertension and cardiovascular diseases, and these are not the product of sudden onset. So I think we should start addressing these issues from the root cause. From when they start developing, we should address the lifestyle, insomnia, stress, so that they do not go into these clinical manifestations. After that, it's only symptomatic management that we are doing. We are so focused on treating the disease that we forget to treat the patient itself. So I think we need to go back to the root cause and look for that.
Very true, Kriti. It was very insightful of you to notice that we are often treating the disease and not the person. We forget the person exists many times and we focus so much on the disease. Let me ask Dr. Sundarraj. He is in the profession of Ayurveda, where you may have seen more of a focus on the mind-body connection. What would you say regarding the mind-body connection? Should we be focusing on that a little bit when we consider many of these psychosomatic illnesses?
As you have correctly described the definition of health according to Ayurveda, Shushrutaracharya says, Samadosha Samagnischa Samadhatu Malakriyaha Prasanna Atmendriya Manaha Swastha Ityabhidiyate. So, even if all the organ systems, every part of the body is functioning properly, when the sense organs, when the mind and the soul, if they are not in a state of well-being, then we don't consider the person as a healthy person according to Sushruta. The definition was given around 3,000 years back, and it is so apt even today. And recently, I'm conducting so many holistic human health workshops. Every month, we are conducting one 7-day free residential workshop at our place. Until now, we have conducted 29 workshops, and this month we are going to conduct the 30th workshop. And there is a contrast because the workshop which we are conducting at our place, people are coming all by themselves. And I'm also going to different colleges, and there I'm giving lectures to so many students. Recently, I've visited some 3-4 colleges in the last month, giving 1-day holistic human health sessions in colleges. So what I see, the difference between people who come by themselves and where college management invite us and ask us to deliver a lecture, there we see that the students are not at all really interested in this particular health part, and unless and until they have some physical disease, they are not even ready to give some time to nourish themselves, to protect their to strengthen their mind, to strengthen their body. So that orientation itself is not there. Even the treatment part, we are treating the disease, not treating the body. But what about the prevention? Who is speaking about not even we are not even addressing the issue of the main focus is there only on living and accumulating the knowledge, skills to and earn money. A student, once he completes his PhD or post graduation, is he able to protect his body? Is he able to protect his family from diseases? This part is missing. But when we look at the youngsters who come to our workshop on them, by themselves, they come to the workshop and they participate so actively. They have a lot of awareness and they have that zeal to understand. Then their focus is more on the mental part also, madam. So the soul part, all the aspects they are interested and they are actively participating. So unless and until we bring it as a part of the system, education system, 1-day workshops, 2-day workshops, they will not help. It should be a part of the curriculum that only will transform the health of this society, and the entire building of a strong, healthy society will happen unless the curriculum is completely corrected. This is what I feel strongly, madam.
Thank you so much, Sundararaji, for your views. I think you have said it rightly that in today's fast-paced life, so much stress is there on getting there fast. Everything we want fast. We want from 3G to 4G to 5G and so on. And we keep going. And what are we losing with that? Or what are we standing to gain from that? That is not very clear. So very rightly said that all these things need to be taken into consideration, and we need to start focusing on health before it becomes transformed into a disease. Thank you for your opinion on that. Let me ask Dr. Panda, do you think we should be looking at the quality of life rather than just the longevity as an indicator of health? Today we think, the longer the age, the more healthy a population is. But should we also be looking at the quality of life? What are your thoughts on this, Dr. Panda? Perhaps I am not able to reach Dr. Panda. Can I put this same question to Dr. Ghoshal? Do you think we should be looking at the quality of life in addition to the quantity or the longevity of life?
Yes, 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 absolutely. Your question is nice questions, and it has been described in the physical quality of life index, that is the PQLI. Within this, actually, the nowadays we are born and brought up from this family. I mean, the parents are guided for this. They're actually we lost the value education. We people are think about the greediness. We should not know about what is the distinguishing nature of the need and what is the greed. So we must think from the very childhood, the value education can improve our life. That is, that value education can create an impact on this, the primordial prevention, before the primary, secondary, and the tertiary prevention is there, the three types of prevention. And before this primary, the one thing is that is the primordial prevention. And within this primordial prevention, that factor is that determinants is that is the honesty, the integrity, the respect, the compassion, the justice, the respect to the others. That in this way, we must change our the quantityness to the quality. That is the main thing of our life, and that should be the goal of the harmony and the globalized. So we must think in a holistic methodology we can apply if in our from the very childhood time, then we can actually uh, achieve this. And whatever we do, that is for our happiness. And happiness in the Sanskrit, the meaning is that is the sukha. The su is the good thing, and kha is the empty space. So that things we must realize each and every one that what is the sukha and what is the happiness. So nowadays the we people that think the material happiness is ultimately the happiness. That's why we are always think about our physics, not the mind. But the mind is original, the physics is the duplicate. If we are don't caring about our mind, then we can't maintain our physics. And that is my the brief uh, think about it.
Thank you, Sudipta ji. I think that is also quite insightful that when we are searching for happiness, if the happiness is not within and we are searching for it outside, then we may
Absolutely,
end up abusing the body also with that.
absolutely, absolutely.
Yeah. Thank you for your views. Let me
Most
come
welcome.
to Manoj Kumar Sharma ji. What do you feel about this, looking at longevity alone or looking at the quality of life also when we consider health? Dr. M.K. Sharma ji? Perhaps I'm not able to reach him. Okay, let's go forward. We can ask Dr. Satyanarayanan ji, what do you feel about this quality of life versus just the longevity of life?
Yeah, quality of life versus longevity, both are needed. Both are important to assess evaluate the health system. But currently, we follow traditional way is the life expectancy the disease incidences, prevalences, as well as the death rate, like that. But all focus, as Dr. Sivitaji told, it focus on physical health only. But health means, well-being means mental, social, psychological, emotional, as well as the social well-being, environmental well-being. So all has to be considered in the quality of life. And you see, what is quality of life? I wake up every day with energy. I can think clearly. I can feel connected to everyone, and I can contribute my life to everyone with enthusiasm. I feel emotionally stable, as well. I don't have stress, anxiety. So all these things are quality of life. Even though you got longevity, it will add only years, but your life has to be added to the quality, and there is added to the life. So for that, we should create some indexes which will measure the quality of life.
Thank
Yeah,
you.
yeah.
Thank you, Dr. Satyanarayanan, for that view on quality of life being very important, not just longevity. Coming back to Dr. Kala, what do you think about this, what was being discussed about lack of compassion for the sick? Do you think this is a genuine concern? What are your thoughts about this?
Pardon, ma'am. Question?
Yeah, the question is that we were discussing the lack of compassion that today the physicians have for their patients. Do you think this is a genuine thing? Do you think this is a concern?
No, that is not genuine, ma'am. So nowadays in the clinic, so we have number of patients are there, but we are spending the time to each patient is very less. Because when we thought about the holistic human health, we have to analyze the root cause for the disease, and not only for the disease and also for the mind well-being too. But nowadays we are not spending that much time to analyze and to treat one patient. So then, because of that only, we couldn't get back the patient. And as per the based on the previous question too, we cannot give you a quality in our treatment. We can improve the longevity, but not the quality. And the compassion for the physician, as per my knowledge, nowadays we are not that much given the compassionate treatment.
Yeah. So that's what I was asking, that it looks like compassion seems to have taken a backseat, or profit maximization seems to have taken an upper lead in this,
Yes, ma'am.
what we call medical industry. Thank you. Thank you for your views. Let me come to a budding medical doctor who may be getting disheartened with all this talk. What do you feel about this when we talk of being a medical industry and not having compassion? How do you feel? Because you are just starting out, you're in your second year, and so very soon you're going to be out there and being part of the system. How do you feel about all this discussion?
Ma'am, in our course from the very beginning, we were taught that compassion and empathy is the cornerstone of this noble profession.
Yes.
But in practice, when we go to OPDs, we do notice that since there are a huge number of patients coming in every day, the doctors are not able to spend as much time with each patient. So, somewhere we are treating them very superficially. And that also adds to the burden of the healthcare system itself. Because by not treating the root cause, we are just making it a loop that they'll come again with the symptoms, then we provide it again. So the patient load keeps increasing. And nowadays, healthcare has become very profit oriented. We are focused on meeting the targets, focused on giving the pharmacological solutions for everything. But in our course, we have been taught to focus more on the patient, to have a holistic approach, to have the empathy for the patient, treating them, giving them time, proper history taking so that we can understand the disease better. So I hope that the generation that is coming forward in the healthcare, the medical student, they have a better approach towards it rather than the pre-existing conditions.
Very nice, Kriti. And I'm sure that you and other youth, the more there is awareness and the more you make that effort, I'm sure you'll be making it a better life and a better world for tomorrow's medical system. Thank you. Let me now come back to Dr. Sundaraj.
Yes.
Yeah, so how do you feel about these various concerns in the healthcare system? Do you think that these are all separate issues that we need to look at individually? Or do you think a holistic perspective could help sort out many of these problems? Dr. Sundara?
Definitely a holistic perspective. Am I audible, madam?
Yes, you're audible.
Am I audible?
Yeah, you're audible.
Yes. Definitely a holistic. Yes. A holistic perspective will definitely solve most of the problems. The previous question you have asked, this is the problem faced by many doctors. When I was in my practice, when I sit with patients come with serious problems like cancer, kidney failure, and they ask us some really disturbing questions. They ask us why I am getting this problem. I'm a vegetarian. I never smoked. I've never taken alcohol. Still, why so many diseases? Why so much of suffering for me? So we know that there are so many other reasons for their disease, but at that particular point of time when the person is suffering a lot, even if we tell them what is the reason for his or her problem, that will not be a big help for them. I always felt that it is my responsibility to tell people who are already healthy that this is the reason for so many problems in the health, present societal health, and it is our responsibility as doctors to educate people in a holistic way. Unless and until we do that, these problems, like there are even though major advances in medical technology, diagnostics and clinical research is there, healthcare delivery is deteriorating every day. And this health information nowadays is more accessible than ever. Digital platforms are there, but misinformation and low health literacy, it is driving the unhealthy behavior of particularly among the youth, and particularly mental health awareness. Now the awareness has increased significantly, but access to timely, affordable and youth friendly mental health services, they remain severely limited. And health systems, they possess advanced curative capabilities at preventive and promotive care for youth. It is still underfunded and underutilized. Medical infrastructure has expanded in urban centers, and particularly in rural and marginalized youth, still they face critical shortages and base of healthcare services. So the holistic human health part, where we address each and every aspect, not just the physical health. We are also addressing the emotional part. We are also addressing the human relations between family members, between the society. We address each and every aspect of holistic human health. That will be the solution, and the solution will emerge when people start looking at when they are healthy. When they are healthy, what can I do not to become a patient? What can I do? And this knowledge should spread fast, and this should go to the education system. Each and every student should know the universal health principles, and they need to understand how to apply them, how to use these in their lifestyle, to in their healthy lifestyle, so that they will never be part of the disease. They never outsource their health to doctor. Such system, such education system is a need of the hour. Definitely holistic human health will solve most of the problems, madam.
Thank you, Dr. Sundaraj. Thank you for giving us that feedback. Very rightly said that until and unless this problem is tackled from the root, or unless and until we look at things holistically, we might be trying to put things together piecemeal, and then when you try to fix one thing, something else goes wrong. And that seems to be happening a lot today. So thank you for your views on that. I think I'll come back to Dr. Ghoshal. What do you think about this when we talk of sustainability? There is an issue that things are getting out of hand. Tests, lab tests are very expensive today. Even before you can diagnose the problem, a lot of financial crisis happens when just we need to get the tests done. So do you think that is an issue? And do you think because of such things, the health system is becoming inaccessible for many? Dr. Sudipta, your views
Yes,
on
yes, yes, yes. You are absolutely right. Nowadays, uh, actually, the multi-specialty hospitals, apart from the government, as we the Indian people, I mean, there is a large number of the population in our country, and so we are automatically uh, the, dependent on the private structure. So apart from the government, the private structure, they are escalating the healthcare costs, and especially the diagnostic area. I mean, the blood test, that is it is huge. So uh, the most of the people, they are actually bypassing this system, the escalating diagnostic testing. So what will be the solutions of it? Uh, the same thing is here also. We must think about, and previously the speak persons, he also told that it should be, we people should think from the very beginning about it, that we must incorporate the idea how to be healthy, how to maintain our health properly. It is not that after the disease occur, then we are thinking about the how we maintain our healthiness. So if we can think in this way, then each and everyone should think, I mean, incorporate this idea and maintain the proper holistic nature of the health, and we can avoid this. And there is no other, I mean, the bypassing system is that to avoid the diagnostic or other. But uh, this incorporating, I mean, the holistic nature, that is uh, the combination of the mind, health, and like this. There are lots of factors behind it, and it can change the theme, and we can maintain our health in a properly, the proper uh, structure of our body. I mean, not the body, that is the human, that is the system, the proper system. By this way, we can.
Thank you. Thank you, Dr. Ghoshal. I think we can, maybe we just have a couple more minutes before we will need to go on to checking with the delegates if they have any questions for any of the panelists. But before we do that, I want to come back to our budding medical doctor here. And I want to ask her opinion on what she feels regarding these sustainability issues. Do you ever have concerns that you are perhaps in a field where there is a problem going to loom up and sustainability issues that the system itself may not be sustainable? Does that bother you? Or are you confident that you could be looking at a challenge here which you can overcome through maybe a holistic perspective or some other means? What do you feel?
Ma'am, healthcare is a field that will always be there, that has always existed for centuries. So we have to make it sustainable. If it's not sustainable, we simply can't get rid of it. There are challenges, and I think we have these holistic healthcare approaches to fix those challenges. Right now, I would say the model is not very sustainable. The way things are going, it itself has made people, the health seeking behavior has come down of people. Because, like Sir mentioned, that before even going to a doctor, you have that mindset that there's going to be at least 5K, 6K worth of tests before you even get the diagnosis. Earlier, we used to hear stories about how only through history taking and physical examinations, doctors would arrive at the diagnosis.
Yes.
But nowadays, every doctor has become very dependent on the tests, on the machines to do that, which has become very expensive for the common man to seek that healthcare. So I think that is a challenge we have to address, not only focusing on the symptoms, not being too dependent on evidences, the tests. I think we need to go back to our roots a little bit. I think we need to start practicing the traditional medicines a little bit, and then we can make this healthcare model more sustainable for the future.
Very nice. I'm so glad to hear from a futuristic youth generation person talking about traditional medicine and focusing on um, challenges and overcoming them. I think that's a very positive attitude going forward. And I think we need more youth like you in our country to make things work. I liked your statement that healthcare has to be there. And if it is not sustainable, it is our business to make it sustainable. So, rightly said, we must be looking for the right answers with the right perspective. Thank you so much, Kriti, for your views. Very insightful. I think now we can open the floor to. Okay, there are some more minutes. So we will take some other questions from our esteemed panelists. If we see, let me ask Dr. Kala, if we look at this medical education, do you think our focus is largely on diseases rather than on health? Do you think that we are teaching our students more about diseases and how to treat them rather than how to stay healthy? What do you feel about this?
Yes, madam. Yeah. The current medical education is based on the treatment based only, but we have to introduce them about the holistic health like yoga, everything, because the prevention is very much important compared to the treatment. So there is no point of you treating the patient already developed diabetes patient. So in the aspect of diabetes, I'm just telling an example. So the prevention is the first one. That's the primordial prevention is the first one. So we have to educate them along with our theory point of view. We have to educate them how to prevent it, like avoiding junk foods and lifestyle modifications, regular walking. Because nowadays every people sitting with a cell phone and spending much time, they don't have even the physical activity. So in our medical education, we have to introduce the new point of view to prevent any disease rather than educating them the disease etiology, pathogenesis, diagnosis, treatment, kind of thing. The prevention, and that is we are learning it from the previously it was from the third year onwards, but slowly they are introducing it from the first year onwards from the community medicine department. So definitely we have to introduce them more now.
Yeah, thank you, Dr. Kala, for your views on that. I think you rightly mentioned, when I go back to thinking of the medical textbooks that we went through, and many of the diseases we looked at, clinical features, etiology, and often the etiology was unknown. And then we go on to the treatment. And so question used to always come up that if the etiology is unknown, we don't know the cause, then how are we going to treat it? So, thank you for your observation. Can I ask Dr. M.K. Sharma the same question? How do you feel? Do you think that in our medical education, we talk more about disease rather than health? Dr. M.K. Sharma?
audible?
Yeah, can you say something again? It was breaking the voice. Yes, please, Dr. M.K. Sharma. Okay, I think there may be a connectivity issue there.
He seems to be not yet unmuted.
What is that? Okay, I think there is a problem there with the connectivity. Dr. Ghoshal, you have a background in homeopathy, right?
Yes, yes, yes.
So in your curriculum, do you look at disease versus health, or is the focus largely on health? How does it go?
Yeah, actually, in homeopathy, we never concentrate on the disease. What is our philosophy is that we treat the patient, not the disease. So the accumulation of the symptoms, definitely it is for the diagnosis purpose is needed for which disease occurs. But we are not treating on the basis of the disease symptoms. We are treating the patient on the basis of patient symptoms. What is his like, dislike, amelioration on the basis of that. That's why the homeopathy, the name is, I mean, the natural treatment and likes cure like. So it is the natural way by which we treat a patient. And the matter is that that is the disease. I mean the what what your question is that we concentrate more on the disease rather than the health. And this is for the profit maximization. The nowadays we are all thinking about the business, the healthcare. I mean the large number of the people we are working in the under the umbrella of the healthcare. So if we think on this matter, that is the health, and health is a combination of the multiple factors, not apart from the physical, mental, and social. So the multiple factor, and that multiple factor is each and every one is very important and pertinent for maintaining a positive health. That positive health is also embarked by the WHO. That positiveness should be come out through the economic, the society, the family, every corner, every aspect of each and every one. And by this way, we can actually the treating, and especially in homeopathy, we treat a disease. And the one thing I want to mention, the last time in the COVID-19 period, in through the homeopathy, we treated the large number of the people only by their symptomatic nature. I mean, what it the worst condition and how the patient feel the relief. So the nowadays even the before the nomenclature, I mean the name was enlisted with the disease. The homeopathy can treat the large number of the people without knowing the name of the particular disease, as because the homeopathy treat the patient, not the. Thank you.
Thank you, Dr. Ghoshal. Thank you for that little bit of knowledge gaining for all of us regarding homeopathy.
Yeah, thank you.
I think we have so many interesting integrative systems in our country that we are fortunate that so many different streams
Yes,
of treatments are available to the people that they can
absolutely.
choose to go their route. Thank you for your observations. Um, Before we get to closing, we have a few more minutes. So I would like to ask this question to, if Dr. M.K. Sharma, are you able to unmute and speak?
Yes, ma'am.
Nice to hear you.
Ji, ma'am.
So I wanted to ask you regarding this question about sustainability of the healthcare system. Right now, there is a lot of challenge in terms of the cost for any kind of medical treatment. Do you feel that it is a valid concern that the health system may not remain sustainable in this form? What do you feel about that, Dr. Sharma?
Costly in the rural areas.
Yeah, we are facing some connectivity issue. So perhaps we can now open up the floor to questions from delegates. If there are any delegates with,
Madam,
I can see a
second.
hand raised. Yes, if you'd like to ask your question, we'll pass you the mic. Dr. Sundaraj wanted to say something.
Yes. Yes, ma'am. Am I audible?
Yes, you're audible.
You were asking about during the teaching part in the college, are we
Yes.
focusing on the preventive aspect?
Yes.
So, luckily, our Indian medical system, health knowledge, if you take any Ayurveda scriptures, whether it is Charaka Samhita, Shushruta Samhita, Ashtanga Hridaya, more than half of the book speaks volumes about preserving the health of a healthy person.
Yes.
And there is an entire topic called Swastavritta, where we speak about Dinacharya, Rutacharya, and Sadvritta. What to do from morning till night to stay healthy, what to do in different seasons to stay healthy, and how to maintain a good, healthy relationship with each and every other person. And that's an entire different topic called Sadvritta, which we again speak in universal human values. So these things have been given utmost importance, and only after describing all these things, then Ayurveda goes to the treatment aspect, describing the diseases and describing the treatments. But the entire first part, and in fact, the prayojana of Ayurveda, prayojanam chasya swastasya swastharakshanam. Ayurveda is here to preserve the health of a healthy person, and whatever is needed, whether it is ahara, vihara, what to eat, what not to eat, when to, and also identifying different mind body constitution types, and it's describing in detail about what should we do according to our own mind body constitution, what type of work we need to do, what type of clothes we need to wear, what type of music we need to listen. In detail we are given this knowledge, and I feel that this is something which we need to share with everyone. It is not just for Ayurveda students or doctors to know and understand. It is for every one of us to understand this beautiful description of health, how to preserve the health of a healthy person, and vast information is there. So this is and luckily we were able to put some of it in the holistic human health with your help. So this has to reach each and every person in this world to build a healthy society, madam. Thank you so much.
Thank you, Dr. Sundaraj. Very rightly said, we need to focus on health rather than on disease. And as you mentioned, in this traditional system, this was very well understood by our ancestors and the people that brought about this system. They very clearly understood that health is a need of every person. whether you give it a name of some system, say homeopathy or Ayurveda or allopathy or whatever may be the whatever may be the the system, but eventually what is desirable is the health of the individual, and that should remain our focus regardless of which system it is coming from. But we should all be working towards the health of every human being, because that is a right of every human being. Very true that we need to look at that. Thank you, Dr. Sundaraj.
Yes.
Yes. But
There is one question in the chat window by Dr. Shivakumar Goyal ji.
yes.
In this world where things are so altered like milk, vegetables, fruits, how can we keep ourselves without diseases as all eateries have pesticides and other chemicals?
Yes. Would you like to answer that?
So shall I address it? Yes, ma'am. Yes. Yes. Hello, Shivakumar Goyal ji. Nice to listen, look at your question. So yes, today we are exposed to so many things which are adulterated and overly processed. We don't get food which is as given by the mother nature. Instead of getting food, we are getting products which are manufactured in industries and packed and sealed in tight labels and tight tins and cans. That is what people are consuming. Whereas human body is its affinity is towards whatever is having life, whatever is available right now in the nature in its original form. Unfortunately, many Western countries have rejected spices exported from India because they are filled with so many chemicals and fertilizers and other things. So it is our responsibility to connect with the producers. There are so many farmers who are producing food products, growing vegetables, fruits, and other things without using any kind of chemical fertilizers and pesticides. But unfortunately, there is no connection between the consumer and the producer. It is a responsibility of us. We have to connect with the producers who are actually doing this. They are producing this Amrita Tulya Ahara. And there are many people who are doing this. But unfortunately, they are looking for consumers who will buy from them. And we are also looking for people who will produce such things. If the technology is so developed that even in villages, people, when Myntra, Flipkart, Amazon can deliver, why can't we connect the consumers and producers? And once the relationship is established, it is our responsibility to assure the producers who are producing vegetables, fruits, and spices that you produce without adding any kind of pesticides and chemicals, and we will purchase. It is our responsibility to take care of you, and it is your responsibility to take care of our health. Otherwise, what is happening? Some person in the city is dying with cancer. The producer who is producing food which causes cancer is not concerned, and some farmer is dying because of suicide, and the consumer who is eating the food produced by the farmer is not concerned about the farmer. So it is our responsibility to connect the farmer, the producer, and the consumer, so that we will have Amritatulya Ahara, and that will solve most of the problems, and most of the diseases can be prevented by having good things. And that is the technology should help, and our awareness and our nature, our intentions, that it is our responsibility. It is not just food, is not just a final product. We need to see it as a end product developed from so many people, and it is our responsibility to all those people. Once we start connecting with the people who produce, then only we can get good food, and then only we can sustain, we can have a healthy life. So this is what I think, madam.
Thank you, Dr. Sundaraj. There is another question in the chat regarding compassion and what technique can be used to try to improve the compassion.
Yeah, I'll answer. Yeah.
So Dr. Satyanarayan would like to.
Yeah. So compassion is the highest form of love generally. But to understand, love, you should come down to trust, guidance, care. All these are right feelings. To understand the right feelings, you should come to right understanding. So this part of you should understand the VOC proposals, which will be tomorrow. It will be a right time to discuss. But anyway, I'll tell one proposal. The other is not the other. Actually, we complement each other. So that's one of the proposal you can experiment. So thereby you will know, you will come to understand that the other, we are similar to each other. We are not the others. So that understanding is there. Then your natural outcome is compassion. So it is normal only, but that will come only when you practice right understanding. Then you will come to know that. I hope I've answered the question.
Yeah, very nice, Dr. Satyanarayanan. I think this is very important to see that, when we think of our family members, we can see our relationship with them, and we would want to do whatever is possible to keep them healthy. But the same thing we don't seem to see when we look at patients or somebody not from our immediate family. Why? Because we don't seem to see our relationship with them. So when we don't see our relationship with them, we don't seem to be concerned about them. So the important thing to do is to be able to see our relationship with everyone. The moment we see that we are related to the other, compassion will not be something that had to be developed. It will flow naturally. So we can explore that tomorrow, as Dr. Satyanarayananji mentioned. We'll talk a little more about the vision for health. And of course, more details are available in holistic health workshops and from the holistic health book. So that I would like to mention. If we have other questions, anybody who from the delegates would like to ask a question, you can raise your hand and we can you can read it.
So one more question is there. That is from Dr. Priyanka Arora. We all are talking about physical health, but there are certain unexpressed issues related to loneliness, feeling of not to express whenever is required, or feeling of being hurt by someone, which are often ignored. Again, related to mental health of the individuals. Please share your viewpoints. Yes, mental health. So, shall I? Okay, yeah, you're exactly right. Currently, the modern medicine is talking about only physical health. Actually, body-oriented approach only. We are currently modern medicine's approach. It is approaching, but as I said, the higher mental health related to emotional connectedness as well as social well-being, as well as other areas also there. Here again, once again, the solution for this to understand this is to understand the whole proposal by UHV. Actually, the human being is not just the body, is a coexistence of self and the body. Self being the conscious entity, and body is the instrument. So that one proposal. Second proposal is we are not isolated beings. We belong to family, society, and nature. Four levels are there, levels of being. You understand that, then naturally you can understand the loneliness. Loneliness is just your imagination. Actually, we are all interconnected. So that you'll understand once you understand these proposals, they can validate by your own experience also. So this is my viewpoint. Yes.
Nice, Dr. Satyanarayananji. So we've been having a very fruitful discussion regarding the state of health of the youth and of the health system today. And we have heard many insightful views from all our esteemed panelists. We have a wide range of views from our traditional system of Ayurveda to homeopathy, to people in education, to student, to all of the pharmacology department, and so many other views that we have heard from different areas. But I think many of us are saying the similar things, that currently we have had many achievements, but at the same time, there seem to be a lot of concerns, and we all have raised our views on the fact that these concerns need to be addressed urgently because the problems are looming large. Our statistics of health in the youth, who are actually our potential, our future, they are in dire need of some solutions, or rather a resolution to some of these issues, because the potential can only be realized when they are physically and mentally healthy. So we all need to work towards that. And we saw how the current system is finding it difficult to continue in its present state. And there seem to be so many different problems that look like very different problems, but perhaps we can address them through a single solution. Perhaps if we look at things more holistically, we may be able to find a solution that fits the need for all of these issues. And maybe we could also look at how the health system today can be made more sustainable. So we'll look at this more in detail tomorrow when we talk about our vision for holistic health. So I would urge that all of us should join together again tomorrow. We will look forward to all of you joining, and I would urge all the delegates also to be with us tomorrow and continue to listen in and interact with your questions, your concerns, so that the discussion can be lively, can be more interactive, and we can look at some of the solutions, because this is a pressing need for everyone today. It is not just my problem or your problem, it is the problem of all humanity. It is concerning the well-being of all. And though our focus in this conference is the youth, but we can see that for every age, this is an issue which is a pressing issue, which is required to be addressed and addressed urgently. So I will look forward to your continued participation tomorrow. All the very best from all of us here. And we shall see you tomorrow. New day with a new look, a new vision for holistic health. Thank you, everyone.
Thank you, madam, for wonderfully
madam.
moderating the whole thing. Excellent moderation. Thank you so much.
Thank you, Dr. Sundaraji. Your views were very well received, and I think there were more questions, but as time is short and we are at the end of our session, so some questions may be addressed tomorrow also, but also we can interact with the panelists separately. Their details can be made available. And if we have personal questions also, those can be raised in a separate platform.